Hello dear students, myself Dr. Maddineni Srinivas. Welcome to my YouTube channel. So in this video we are going to look at one very important theory question for undergraduates, which is Erythema MultiForme. We are discussing all these topics were already discussed, whatever are highlighted. So, okay, you can check them out. I will leave the links in the description, also in the chat section, comment section. Okay. So we'll directly jump onto the discussion topic for today. It is Erythema multiforme, which is in short written as EMF, Erythema multiforme. Students, it is an acute self-limiting inflammatory skin condition that manifests as very important buzzword. You need to remember target lesions or iris lesions. Basically, EMF is a hypersensitivity reaction that is mediated by the CD8 plus T lymphocytes, which is going to affect the skin and also the mucosa. The condition can affect individuals of all the age groups. There is no any age restriction and it has a recurrent nature. So you might be wondering, sir, why does it have a recurrent nature? Because the triggering factors or precipitating factors, if you know the most important precipitating factor, you will understand why is it recurrent in nature. So remember students, Erythema multiforme is categorized and discussed under drug reactions, but remember very important point, the most important triggering factor is not medication, it is infection due to the herpes simplex viral infection. And I hope all of you know that herpes simplex viral infection, it produces herpes labialis and herpes genitalis, and both of these have a recurrent nature. That is the reason why EMF is also having a recurrent nature. Okay, and there are other association triggering factors also, like for example of virus, infectious mononucleosis. But you need to remember that mycoplasma pneumonia, this is the second most common association of Erythema multiforme. So you can remember herpes simplex virus and mycoplasma pneumonia, and certain medications like for example sulfonamides and penicillins, these can also act as triggering factors. And in the systemic diseases, you can remember that systemic lupus erythematosus, which is a connective tissue disorder, can also be associated with Erythema multiforme and the target lesions, which we can see. So what is a pathogenesis? Pathogenesis, you can remember that so I will just write down in the form of a flowchart. You can write this in the examination. So whenever there is any infection, like for example herpes simplex viral infection, it is going to cause the damage of the epidermis, because of which the epidermal antigens will become exposed. Epidermal antigens are going to become exposed, and it is these epidermal antigens which are going to trigger the Erythema multiforme. And ultimately, you need not remember what is the mediators and all, but ultimately what will happen, there is going to be activation of CD8 plus T lymphocytes, and it is going to ultimately produce the keratinocytic apoptosis. Okay, so this is the flow chart which you can write it in your exams also. So coming to the general clinical features, it is commonly seen in the males and it is commonly seen in adolescent and young adults. Remember students, usually the drug reactions, they will be commonly seen in elderly age group, middle age, because they are having polypharmacy. But because this is associated with the infection, so that is the reason why adolescents and young adults are more commonly affected. And like I have told you, it is preceded by herpes simplex infection in 50% of the individuals. Very important point to be remembered. And lesions, what are the characteristic lesions we can see? We can see macules, papules, fluid-filled vesicles and bullous lesions. And what is the distribution? Distribution is also very important. The lesions are going to be classically seen over the more and more distal areas, that is the palms and soles. This distribution is very important. And how are the lesions going to spread? The lesions are going to be spreading more from distal to the proximal end. So we call it a centripetal spread. And remember, we have discussed this Koebner's phenomenon in great detail. Okay, so I will write it down here. So predilection for sun exposed areas is seen because of the Koebner's phenomenon. So whenever there is trauma, there is going to be development of morphologically similar looking lesions, which is called as Koebner's phenomenon. We have discussed Koebner's phenomenon in a great detail. I will leave the link for the video in the iCard and also in the comments in the description. You can check that out. So next is the characteristic lesion. So remember, this target or iris lesion, very important term. You need to remember, why is it called as a target lesion? Because you might have played this dart game in which there is going to be a target where there will be a central red zone followed by a peripheral red zone followed by intermediate, there will be a white zone. So similarly appearing lesion will be present over the skin in these patients of erythema multiforme, where the center is going to have a dark dusky hue, which can also have some bullae, and intermediate zone of paler will be present. Intermediate zone of paler will be present at erythematous outer ring. So these are the three zones which will be present, 1, 2 and 3. So I will mark it here. So this is the one, this is the second pale zone, and finally you have this erythematous peripheral zone. So these are the three zones which we'll see in the target or iris lesion, and this is also called as bull's eye because it resembles a bull's eye. Coming to mucosal involvement, very interesting things are there here. So oral mucosa is commonly affected. Remember, there can be mild symptoms like, for example, pain or maybe present. Okay, and depending upon this mucosal involvement, we have certain subtypes. What are those? So cutaneous lesions without any mucosal involvement, if it is seen, we call it as erythema multiforme minor, EM minor. With mucosal involvement, we call it as erythema multiforme major. And like I have already told you, herpes associated erythema multiforme and mycoplasma associated erythema multiforme. We have these subtypes which you can write down. Okay, it's not very difficult. Mucosa, if it is not involved, it is erythema multiforme minor. If it is involved, it is erythema multiforme major. So in the differential diagnosis, one point I want you all to remember. So it is Stevens-Johnson syndrome. Was, you know, earlier erythema multiforme was categorized as one of the component of spectrum of the SJS and TN. So SJS and TN also we have discussed. I will leave the link for the video in the iCard and also in the comments in the description. So previously it was a part of this spectrum, but now it is considered a distinct entity. So not related to the SJS and TN. So in this video, if you felt that there was value and it was helping you to understand the erythema multiforme, please do hit that like button, and if you are not yet subscribed, please do subscribe to this YouTube channel. Now coming to the treatment part. Treatment part is general measure. So the patient is going to have mucosal lesions and there's few skin lesions mainly over the extremity. So you need to identify what is the triggering factor. Like for example, if it is a herpes, treat the herpes, and if it is due to the drugs, withdraw the drugs. Medical treatment depends upon the severity. If it is a mild involvement, we can prescribe topical steroids and give some antihistamines. If it is moderate to severe, admit the patient, okay, and give systemic corticosteroids, antiviral therapy if it is acyclovir, and antibiotics for the mycoplasma associated. And supportive care, hydration must be done, and nutritional support, because it will be difficult to eat, isn't it? Mucosa will be involved, so then we have to take care of the nutrition. So just to summarize erythema multiforme, it is an acute self-limiting hypersensitivity reaction which is mediated by CD8 plus T lymphocytes, and most important trigger is herpes simplex viral infection, and target lesions can be seen. These are also called as iris lesions or bullseye lesions. Management includes stop the drug if the cause is drugs, and treat the infection if it is due to the herpes. And if it is mild, you can just give some topical steroids and antihistamines, but if it is severe, systemic steroids, admit the patient for such severe cases. Okay, I hope this video was helpful. Please do hit that like button if it was helpful, and if you want any other topic to be discussed by me, put that topic name in the comment section. And also do share this among your friends, and also do discuss this, read from these sources, okay, and try to discuss with your friends, so that it will be more and more engraved into the memory of you. Okay, thank you so much. Happy learning. All the very best for your examinations. Sarvam Sri Krishna Sarve Jana Sukhna Bhavantu. Thank you so much. Bye bye.